Perhaps to start with, I should say that all animals that use their teeth to live with, the teeth must meet perfectly or they would not live. They eat their food by chewing it with their teeth. They cut off lumps of food and they then chew the food. And if the teeth do not meet perfectly, they will not live. Therefore, that put very heavy pressure on the evolution of the jaws of all mammals and most other animals too, that the teeth meet perfectly. Now, the growth of our jaws is controlled by genes, just as the rest of our body. But genes do give good control, but that control is not perfect, and it cannot ensure that every tooth meets perfectly. Therefore, a system evolved whereby the posture of the tongue, the lips, and the jaws controlled the way they met. And this is why all animals' teeth meet perfectly. When you think of a crocodile has its front teeth on the end of two jaws, which, if you think of it, are about 6 foot apart. And yet those front teeth meet perfectly. The genes cannot control that. It has to be controlled by posture. And that is why the posture of the human jaws is so important in developing correct shaped teeth, jaws, and faces. And if you have bad posture, your jaws will not grow correctly. Your tongue should rest against your palate, with your lips gently closed and your teeth in light contact for about 4 to 8 hours a day. If you have that, you will have perfect teeth. But sadly, today we have a very different lifestyle. We eat soft food. Many people leave their mouths open because of allergies. You pick up allergies in houses. And that is why so many people now have malocclusion. The primary purpose of orthotropics is to train people to correct their own posture. But of course, when I first see patients, many of them have had bad posture for many years, and therefore I cannot start with a perfect model. Therefore, I have to do some alteration. Usually, the upper jaw requires enlarging a bit, and then the lower jaw has to be trained to close up and forward. But that is done by training posture, both with exercises, but mainly with appliances. The main problem with jaws are that they are too narrow, and therefore the best way of enlarging them is to widen the jaw artificially. The reason the jaws are too narrow is because the tongue is not resting up there. Many children keep their tongue down, and particularly when they swallow, they suck on their teeth. And that causes the jaws to become too narrow. To correct this, we use an appliance which I basically designed, about 50 years ago, that very gently widens the top jaw. The rate of movement of the top jaw is very important. If you open it too fast, you will damage it. If you open it too slowly, you just tilt the teeth. and therefore you must mimic, that is copy, the same rate as the natural growth of the jaws. In simple terms, that is about 1/16 of a millimeter per day, which is about a hair's breadth. Doesn't sound much, but that is the ideal rate of movement. If you open at that rate, you will not tilt the teeth very much, but you will over time get gentle development, not just of the width of the maxilla, that's the upper jaw, but the shape of the whole of the upper jaw. I was taught as a student many years ago that the growth of the jaws was genetic, and some people have big jaws, some people have small jaws, and the jaws often do not match. But subsequently, I realized that everybody is born very similarly, and the growth of the jaws depends on basically how they use them, in particular their posture. Now, as far as you in particular are concerned, you say that they think your top jaw is more or less all right. I can look at you and also take measurements of you, which tell me that your upper jaw, looking at you, I would say was 25 millimeters too far back. That is an English inch, this much, which is a big difference. Now, your lower jaw, I think, is slightly back. Now, most people would say it was too far forward, but I think that is relative, and that because your upper jaw is so far back, your lower jaw looks too far forward, but in actual fact is more or less its correct shape. It is too far down, it should be further up. As a result, your teeth do not meet correctly. Perhaps I can illustrate that. This is where your teeth should be. The upper teeth here, the lower teeth here. Now, because you left your mouth open when you were young, and because you did not keep your tongue in the right place, your bottom jaw dropped down like this, your top jaw dropped down like that, and then your teeth went like that. So that is how you are now, but really you should be like that. It could be cured quite quickly with surgery, but surgery is traumatic. I originally trained as a surgeon, and my work was correcting the position of the upper and lower jaw. We would cut the bones in half and bolt them together in different positions. But of course, this is very traumatic. You often cause damage, and it is never natural. When you use surgery, you can always see that the change in appearance is artificial. It does not look right. And it is also still susceptible to posture. Even after surgery, if the posture is poor, the teeth will go back to where they were. And this often happens with surgery. In fact, for many surgical operations, the relapse rate is as high as 50%. I don't like to be kind about my colleagues. I am an orthodontist, but I do think many orthodontists are guilty of talking about their successes, but not about their failures. But then I am the same myself. We are all the same. Well, if you have a narrow jaw, there are many, many ways of widening it. But most of the methods are thought out by orthodontists, and essentially orthodontists do things. They are mechanics. And most orthodontic treatment is actually mechanical. My treatment and my beliefs are that it should be natural. Your face should grow the right shape naturally, but doesn't because of your lifestyle. Therefore, we should try and mimic or imitate the natural posture and the natural movements. Now, you cannot produce an artificial tongue, but the nearest you can do is use an appliance which moves or acts like a tongue. Now, when I designed what I call the stage 1 BioBlock appliance, I based that on an appliance made by an Austrian called Schwarz. He produced this back in the 1930s. Remember, I'm very old. So I adapted that to create my appliance. Now, I may be a conceited old man, but I think I made that appliance 50 years ago, and I still think it is much better than any other appliance. I thought of many, many factors that are important, because widening the jaw is only part of what you need to do. It is almost more important to move the jaws forward, and that appliance helps to do that. But also, the upper jaw is designed in lots of little bits, if I can tell you. There are 9 or 10 bones which make up what we call the mid-facial complex. Now, all of those are attached to each other, and all of them move in slightly different ways to create a natural face. If you use surgery, you do not create a natural face. So when I am treating someone, I will widen the upper jaw. Now, the lower jaw, you cannot widen. It does not have what we call a suture joining the two halves. That closes at the age of about 1. Therefore, you cannot physically widen the mandible. However, natural posture widens it automatically. This is what orthodontists do not realize. But another factor is that if, I explain again sideways, if I start maybe with a patient like this, I want to take the jaw forward. Now, the jaw is actually this shape, so that as it goes forward, it gets wider and wider. Therefore, the mere fact that you bring the jaw forward will automatically widen it. But that is not enough. You need more widening for many people. Not yourself, you have a wide lower jaw, but many children have very narrow lower jaws. Do not try to widen it with mechanics, because you will cause damage. But if you widen it partly by bringing it forward, it will also widen with the posture of the tongue and lips. These are very, very gentle forces, but the teeth will gradually widen. I can show you many examples where I have widened the upper jaw, and with my appliance there are special rests for the lower teeth to rest on. Then they can gradually widen over time when the posture is right. Now this, as you can imagine, is an entirely different system to the one that any orthodontist I know use. But this is what I do, and I can show you many cases where the lower has started like this and done that, and I have not touched it. But the tongue and the lips have. this is very important. Very few orthodontists believe me when I can say I can make both the upper and the lower jaw grow forward. The research shows that this is impossible. You cannot move the jaw forward more than 2 millimeters, maybe a bit more. But I have found that if you alter posture, you can create a lot of growth. I will routinely move the upper jaw 10, 15 millimeters forward, and I will move the lower jaw 25, maybe 30 millimeters, certainly if I have a young child, not in an adult, obviously. But I do this by basically encouraging the natural growth. Now, I will turn sideways again to show this. If we start like this, now many people simply bring the lower jaw forward, and that is better. But if you want a good result, you want to take the upper teeth further forward. Now, people say I am mad to do that, but I know I can bring the lower jaw forward later. So I will start by moving the upper teeth like this. Start here and do that. Now, if the patient then learns to put their tongue here and their lips there, the teeth will then do that. So in fact, I'm moving the teeth from here to there. So the bone is growing with the teeth. Therefore, the whole of the jaw is moving forward. Or that maybe I'm wrong. Maybe the jaw isn't moving, but the bone is moving. But regardless of what happens, the actual maxilla is much further forward at the end of treatment. The condyle is growing all through life. Anybody who holds their jaw forward, it will grow forward. And that is how I can bring the lower jaw, as I say, I really mean it, 25, 30 millimeters further forward. When orthodontists tell me the research shows you cannot move it more than 2 millimeters. That is a huge contrast.
So, we wanted you to explain the mechanics of the bioblock stage 1. How does it work to widen and bring the jaw forward?
Well, I based the stage 1 appliance on the appliance of Schwartz, dating back to 1930s. But I improved it in several ways because, firstly, I wanted to widen the arch, but I also wanted to lengthen the arch. Also, I did not want to interfere with the tongue posture. Now, Schwartz's appliance, there is plastic all the way over here, which means the tongue cannot push against the rugi. Now, it is very important that the tongue is able to do that. Now, in order to lengthen the arch, I added 2 wires here, which I call the catenary wires. And they are adjusted very gently to tilt the upper teeth forward. Many people think that is wrong, but I will upright the teeth later. Now, at the same time, I need to widen the jaw, and we have a screw in the middle of the plate. Each revolution of the screw opens the appliance about 1 millimeter. Therefore, during treatment, we open the screw a little bit each day. With older patients, I will open it a little bit each morning and evening. But with younger patients, it is okay each day. But we have to be very careful of the thickness of the periodontal membrane which surrounds each tooth. Each tooth is set in the bone, but if you push on the tooth too hard, it will push the root to the side of the socket, then the blood will not be able to reach the cells. And if you leave it like that for several hours, the cells will die and cause pain. That is very important. Now, one equally important thing is that the upper jaw has a suture down the middle, so you can widen it. The lower jaw does not. Therefore, I needed to be able to widen the upper jaw without widening the lower jaw. Therefore, I fitted 2 shelves each side here so that the teeth rest on that. As the upper jaw widens, the patient then just bites on the shelves, but the jaws are still supported and there is still no force applied. If you widen the lower jaw at the same speed, you will damage the teeth and the roots. But here, the shelves, that's right, have a slight slope on them so that they automatically widen the lower jaw a little bit, but allow the jaw to close together so the patient can eat without the lower jaw dropping inside the upper jaw. As I said earlier, there is a clip each side in the middle of the jaw. If you push on the catenary wire, the brace will simply tilt. So we have a rest on the very back tooth, so that when you push on this wire, the brace does not tilt. And that is very important, which is why you must never put the clips on the back teeth, because then if you push with the catenary wire, you will just tilt the appliance and the teeth. You widen it until I usually, for maybe a 10-year-old, I will widen it about 10 millimeters. When I was taught as a student, I was told never widen more than 4 millimeters, but I often widen 15 millimeters. You will not damage the bone or the gum, certainly not in a young child. But the important thing is the speed of opening and the care that you take. I think an adult male, the distance between the first molars, which are these 2 teeth here, should be about 44 millimeters. I think primitive men were a little bit more than that, but 44 is okay, and maybe for a woman 42. But I do not know the average age in Sweden, but the average width in England is 33.5 millimeters, and that is not enough to hold 32 teeth. But if you have 44 millimeters width, then that is plenty of room to hold all the teeth in the right position. When you use the catenary wire to move the teeth forward, you are also expanding the appliance, so you will tend to find you get spaces between the teeth. Obviously, you do not wish this. Therefore, we have a wire each side here, quite small wires, which press on the lateral incisors, and they then simply close the spaces together. And because the catenary wire is pushing from behind, you have 4 straight teeth in the right position, which means you do not need to use brackets, which most orthodontists use to position the teeth. But the Crozat clip is so tight that an 8-year-old should not be able to remove the appliance. It actually acts as a fixed appliance for young children. Older adults can remove their appliance, but that gives you an idea of how strong the appliance is, and it needs to be that tight or the adjustments will not work.
So how do you remove the appliance from an 8-year-old?
Well, for small children, their mother needs to remove them so they can clean their teeth, but the rest of the time it stays in. Many people are too kind. The number of mothers who say, oh yes, just take it out to eat with, it will not matter. Yes, it does matter. They must never take it out to eat with, or the treatment will not work.
So only when you brush your teeth will you take it out?
And to open the screw. This is Stefan. I am Professor John Mew. Stefan contacted me on the Facebook originally. I've never met him until today, and yet I have diagnosed him and told him what I think is wrong with the development of his teeth and jaws. I've also told him what I think will make him right. The big problem is that most of the cause of his difficulties and the incorrect bite he has is due to his oral posture. That is the position in which he keeps his tongue, lips and jaws. The concept of orthotropics, the treatment that I do, is that unless you can correct the posture, you will never correct the growth of the jaws or indeed the face. In order to treat this, we try to give people exercises in order to correct their posture. But sometimes, after a period of time, much damage has been done. And Stefan is now 40 years old, and his jaws have been in the wrong position for probably 25, maybe 30 of those 40 years. Now, that is because of his tongue posture mainly. He has very bad tongue posture. I can't unfortunately demonstrate that because the tongue is inside the mouth, but you'll have to take it from me that his tongue touches both his upper and lower teeth and is actually between his teeth quite a bit. You might wonder how he can eat, but the tongue keeps out of the way while he's actually biting, but the rest of the time it pushes on the teeth, and this moves the teeth and the jaws and the face out of position. Because he is quite severe, we have taken records of his mouth, and I have plaster models here, and as you can see, we have designed an appliance which will achieve several things. The most important thing is to enlarge his upper jaw, which is at the moment, I would guess, about 30 millimeters too far back. That is a huge distance. We're talking of a distance like this. Now, we will never bring it forward that amount, but if we can get it forward even 5 millimeters, that will be enough to get his mouth and face more or less right. So that is what my objectives are. But of course, we may have to temper those as treatment goes through. Now, initially, I'm going to try this upper appliance in his mouth. Now, if I take it off the model, you can see that it has a wire which comes down in front of his teeth. So the appliance fits in his mouth like this, and this wire then fits around the front of his mouth. Now, the idea of that is to hold back his lower jaw, because if he touches the gum, he will have to learn to keep his jaw back. Now, I can see from just looking at it casually that this wire is not correct. So it's going to be a problem trying to fit it. But I will first put it in his mouth with his mouth open. Then I will ask him to very gently close his mouth. We may have difficulty even fitting it because the impressions which you see there were taken 4 or 5 months ago, and the teeth will inevitably have moved to some extent. I hope it won't be too uncomfortable for him, but certainly it will be somewhat uncomfortable and certainly a big mouthful. All right, Stefan, let's try it in. I seem to go that, pull back the cheek. Now, there we are. Let me pull back the cheek here. That fits reasonably well there. That's not fitting up there, I'll see why. Right. It's bouncing a little bit, but that's due to the fact that the teeth are moved. How does that feel, Stefan?
It is very tight.
I thought so, but that's because your teeth have moved. I'm afraid it fits in quite well, actually. I mean, you can see I can do that and it won't come out. The clips, which we call Crozet clips, are very strong, but the trouble is his teeth are moved, and I'm afraid Stefan is going to have an uncomfortable 2 or 3 days. We should take another set of appliances, but then we would have to wait several weeks to do it. Do you want me to do that, Stefan?
What?
Take some more appliances and try again? Or are you willing to put up with a bit of pain at the moment?
I can try this. I think in a few days the teeth will hurt, like you said.
I think you're right. It's a question of how much and whether you can pull up with it. Yeah. Now I'm going to pull this round your lip. Now can you very, very gently close? Yes. That was not too bad, is it? See how you can see? This wire is quite close. If he moves even a millimetre forward, it'll hit. But this one here is a long way off. It should be down and in. Is it touching the gum anywhere else? When you bite, does the wire touch around there?
It's touching here, I think.
Yes, don't worry about that. Is it touching around here anywhere?
I don't know. I don't think so.
Good. I mean, it shouldn't do. The only place it should touch is there, but when you bite like that, let me see. Is that touching on? No, bite together. Bite. Can you bite, or is that too painful?
Okay.
Try and keep together. That's it. Keep still like that. Now, looking at your lips, this side looks more or less right. You can see here, it is very close to the gum. Yes. If he moves his jaw forward at all, that would be painful. But on this side, it is not so bad, is it? Is it touching very slightly there?
I think so, yeah. I think so.
But like up here.
It feels like it's touching somewhere, yeah.
Okay. Okay, well, I will adjust that. I mean, it's too tight in your teeth.
It's very tight on the molars.
Yes, it's going to make them ache. Either I take another impression and we come back, or you put up with the pain. It won't kill you, but you'll be very unhappy. What do you want?
I think we will try this one.
Okay.
We will try
well,
this one.
Well done, but you won't be happy.
No, maybe I have to eat liquid food for a few days. What do you think?
Well, have some pills or whatever, but I'm perfectly happy to make you another appliance if you want.
No, I think we will try this one.
Okay.
Yeah.
But now, in that position, is it actually touching on the gum uncomfortably or not?
It is touching here. It is not less uncomfortable, but it may be.
Try talking without dropping your chin.
Ah, you mean like this?
Yes.
Talking with your teeth
together.
Yeah.
Just for the moment.
Yeah.
When you do that, does it touch on the gum anywhere?
Is this touching here?
So that you notice it or barely?
I notice it.
The light's not very good here. Okay, I could move that very, very slightly forward. Now to take it out, open your mouth and put your finger up on each side, on the side of the clips. No, not there, on the clips of the back. There, with your nail, push down the wire. That's right. Okay.
I think it's not touching up in the palate.
Well, I think that's because your teeth are moved, so it's not really seating right home.
Okay.
I think after a day or two, your teeth will move again. Then it will touch all on the top of your mouth there.
Okay.
Now, the wire which fits in takes out. Try pulling it back. You can take that wire out.
This one?
Yes, but you take it out here. Yes. You need to learn how to do that, because when you eat, that's right, and put it back again. Can you see, or is the light in your face?
No, I see.
That's well done. So you fit it back in there. That's right. Now try putting it back in your mouth. You need a mirror.
I can try without. Okay.
Yes, push it up on those two sides. That's well done. Well done. I mean, I'm not happy because I know it will be uncomfortable for you, and I don't like to do that, but you know the circumstances.
But so when I eat?
I will adjust so the fraction form. You take those out to eat with.
And then I keep the appliance in the mouth?
Yes.
Okay.
And you try and keep your mouth shut all the time. Try and talk with your mouth shut.
Where should my tongue be? My tongue?
Well, you try and put the tip of your tongue in that spot on the palate which you can feel.
Yeah, there's some wires, I think it's the approximating wires, and the catenary wires are there.
They are.
Behind them.
Yes, well, you should fit it round them. You will notice them, but they are quite close to the teeth. I don't think they will displace your tongue. It's just that your tongue won't be, well, will touch them inevitably.
Yeah. So, should I keep my teeth together when I speak?
Yes, for the well-being, certainly. What I don't want, when you speak and open your mouth, you tend to push forward, and that is what I want to stop. Here we have a young 8-year-old boy. You can see that his teeth are really quite crowded. If you look carefully, you can see that his tongue is pushing against his teeth. Now, many people would think that would cause the teeth to enlarge, but because he swallows by sucking on his tongue, that collapses both the upper and lower arch chin. And you can see that his teeth are actually slightly crowded. There is a gap here which is too small for the tooth which should go inside it. And all his teeth, I would guess that his mid-face, even at this age, is probably 10 millimeters, maybe more, too far back. And therefore treatment is needed quite urgently to take the whole of his mid-face forward now, so that we can correct his posture, so that he can then take it further forward as he grows up.